Greg, for allowing me to be on this panel. It's an honor to speak to everybody today. I love lots of things about TSFL. I actually have a list of 10. I probably won't get through that since we're only a few minutes, but I'm at least try to get through the top 5. The major thing for me is that it filled a huge void in my practice. According to the Center for Disease Control, 2.1 million people in America die every year. 2 out of 3 of those deaths are preventable. And if you look at the primary causes of preventable death, number 1 is obesity-related disease. Over 450,000 people die every year from obesity-related disease. And what do we do in medicine, conventional medicine? We really don't have anything to offer for that. As Dr. Ray explained yesterday, we have a lot of things that don't work. And I was frustrated about that for years until I Take Shape for Life. So I really provided the avenue to address that problem that was lacking in practice. Second thing about Take Shape for Life is that, as opposed to a lot of different companies that you have to adjust what you do to what they want you to do, Take Shape for Life asks you what you want to do and customizes the approach to what you need, what your patients need. And that was really great for my practice because I was very busy. Didn't have a lot of time, so we put appropriate. We used all the Take Shape for Life tools. We used the tools. They let them work for you. With signage in our office, I have a BMI chart in every exam room, and that graphic from the Cleveland Clinic, what I call the Paladine. And so a lot of times the conversation started before I even, as a patient's memories on the BMI, or looking at Paladine. The conversation gets started before I even go. And so because of that, we've had huge success in the practice. As I mentioned yesterday, 6,000 pounds weight loss in the first year, many medications and medical problems gone. And that's literally transformed my practice to one now giving hope as opposed to just treating disease. And that's really important. I had an episode, I used to work in critical care unit, and a number of years ago, I had a lady who was critically ill, was on a respirator for 100 days, and she pulled through, and I met with her a while after when she was back to health, and she said, I want to thank you that every day you came to the ICU, that you told me what the plan was for the day, and you squeezed my shoulder and said, I'll see you tomorrow. And I think that as health coaches, that's what we do. We give people that hope. She said, that was my hope for the next 24 hours. I knew I would survive the next 24 hours. She said, you see me tomorrow. And a lot of patients who have tried 7, 8, 9, 10 different programs have lost hope. And those calls that we give, the text messages, the emails every week, continue to give them that message that they can do this, and that's their lifeline. And so that's critically important with what we do. And not only transform our practice, but then, as healthcare professionals, we want to grow healthcare. So, with my wife, who has a little bit of energy and a lot of enthusiasm, and a dedicated team of health coaches, we've not only been able to help a couple hundred patients a year through the practice, but with those expanding our reach, we now have tens of thousands of people a year. And as a health professional, that really gets me going. So I know I sometimes don't show it for you, Dr. A. I'm pretty passionate about this. The last thing I want to share is that it's learning. I love the learning of Take Shape for Life. My very first day in medical school, this 86-year-old emeritus professor of medicine came up and said, I have one thing to tell you, never stop learning. The day you stop learning is the day you should retire. And I took that hard. And every event I go to, I learn something that Take Shape for Life. This is not medicine, it's something different.